Thank you, sir.
Yes, sir. Thank you.
All right. Meanwhile, to a new showdown on the new health care law, 21 Republican governors in a letter to Health and Human Services Secretary Kathleen Sebelius outlining 6 changes they would like to see made to do the overhaul. But do they fear that the more they fix, the less likely they'll get what they really want, which is full repeal? Republican governor from Georgia, Nathan Deal, joining me right now. Governor, good to have you.
Thank you. Nice to be with you, Neil.
I guess you're just sort of covering yourself, right? I mean, short of a repeal, this is sort of the alternative track, right?
Well, obviously, we would like to see it repealed because right now we're still under the mandates that the legislation places on the states. But also we think that even if it's not repealed, they should give us some flexibility. The agreement at the outset was that we were locked into mandated benefits, and we have no flexibility to implement the program. Obviously, my first choice would be to repeal it. As a member of Congress, I voted against the legislation to begin with.
That's right. I forgot you became a big cheese. You're a governor now. But could I get your sense then of what would be some of the big things you'd like addressed right now, without going into everything, but some of the big things you want torn apart as we speak?
Well, the first thing is that under the current arrangement, states have no flexibility to alter their benefits. In other words, the only area that we have any flexibility in is to do things in the unmandated area. And my budget has proposed that we eliminate some of those benefits for adults, for example, for vision and for dental, et cetera. And also the only other option we have, which I've had to include in my budget too, is to ratchet down reimbursement to providers. Neither of those are very good alternatives, but we are locked into a system where we have no flexibility currently.
We could go on the 1099 provision, all that they're actually moving on, changing right now. But do you think the president, because that's the only one he mentioned, sir, this 1099 thing where businesses are required to fill out forms for the business, for the health benefits they provide their workers, that's as far as he's really going to go?
Well, that certainly is just a very minor part about the legislation. The fact is that at the state level, it is a very real problem. Let me give you an example for the state of Georgia. Under the mandates of that legislation, we will see a 45% increase in our Medicaid enrollment population. That translates into about $2.5 billion for the state of Georgia alone to participate in this expanded mandatory program. That's the kind of cost that our state can't afford because we have to have a balanced budget. And I think that's why you're hearing other governors speak out on the issue as well.
Not that this would happen, Governor, but I talked to a number of contacts in Washington, including some at the White House, who are not just the landscapers and cooks, who were telling me, I bet, Neil, if you were to ask prominent Republicans, probably like you, Governor, if we provided and covered all the cost of their Medicaid reimbursement issues, they would still complain about and find something else that as an excuse to stop supporting this. What do you say to that?
Well, even though the promise was that they would pay 100% at the beginning and then go down to 90%, the reality is that that does not include all the costs that are associated with the state. Under the exchanges that are required, our state is going to have to place our state employment benefits that includes health insurance. We have to comply with those mandates as well. That is totally apart from the cost associated with expanding Medicaid.
You know, you're right about that. There are multiple expectations for you guys. Governor, thank you very much. Very good seeing you. Congratulations, by the way.
Thank you very much.